We're waiting just for our fourth speaker, but since Sheila was speaking last and she's caught in traffic, which is not quite as bad as I'm sure the traffic in New York City is, we're going to begin tonight. As you know, this is our second open classroom following last week on the whole question of healthcare. Tonight we're going to talk a little bit more about cost containment, and we have four wonderful guest speakers to join us. I've asked my dear friend, Sonia Chang-Diaz, Senator Chang-Diaz, to introduce our first speaker. And without further ado, Sonia.
David, this is when you know you've hit the bid time. You have two people go before you in the introductions. Good evening, everybody. So we did, as Vera mentioned, have a wonderful discussion last week about the Affordable Care Act and the history through the 20th century and into the 21st century of national efforts to implement universal coverage of some kind. And learned during that discussion that whether it's in states like Massachusetts or Hawaii that have near universal coverage, or states that don't have near universal coverage, the private sector, the public sector, even other countries, that the trend line for healthcare costs is just going inexorably upward. And so I think everyone was left with the suspenseful hanging question last week of what do we do about that issue of cost containment. And we knew when we undertook the universal healthcare reform in 2006 here in Massachusetts that was only going to be chapter 1 of healthcare reform, and that we were signing ourselves up for chapter 2 of healthcare cost containment. So fast forward 6 years to 2012, we have started writing that chapter 2. And we are very lucky, of course, in Massachusetts to have the vanguard of expertise on this issue right here in our home state. And we're going to hear from many of those different angles and experts. But it is my great delight to get to introduce David Seltz, who has been at the epicenter of work in Beacon Hill, both on the first round of healthcare reform and now our healthcare cost containment bill that we just passed in the legislature this past year. David started out as a Ways and Means analyst in the Committee on Senate Ways and Means as their healthcare analyst, and then continued from there into the Senate President's office under Therese Murray, our current Senate President. And he really is, in my short 4 years so far in the legislature, I will say, one of, if not the most universally respected policy experts roaming the halls of Beacon Hill. And he's so good at this job, and he was the Senate President's point person on drafting and negotiating our healthcare cost containment bill, and he was so wonderful at that job that the governor snapped him up to head up the executive branch effort to implement this bill and now put it into reality. So he now holds the title of Special Advisor on Cost Containment to Governor Patrick. In addition to all of those very august titles, David is also my constituent. And I want you to note a very snappy dresser. Please note the stolen crossbones tie. So without